Hello, everybody. Thank you for having me here today. It's an honor to be joining each and every one of you for this Maternal Health Day of Action. When I gave birth to my baby girl in 2018, she became the first newborn allowed on the Senate floor. But through my 9 months of pregnancy and my time in labor, I wasn't thinking about changing the Senate rules. I was thinking about staying healthy. From hectic moments in the delivery room to the sleepless postpartum days, every woman who has given birth understands that having access to high quality maternal care providers can make all the difference in the world. While I'm lucky to be healthy and have two beautiful, healthy girls, I know there are so many women across the country who can't say the same because their pain and symptoms were ignored or overlooked. I know because I've seen the stats. I've read the horror stories, and today's discussion will help underscore that we have a maternal and postpartum care problem in this country, that we're the only developed nation in the world where the rate of women dying of pregnancy-related preventable complications is still rising. For Black women especially, the rising maternal mortality rate and medical racism in our country is a true crisis. On average, 75 women in Illinois die each year from pregnancy-related deaths, but more than 80% of those deaths are preventable. That means daughters and sons growing up without their mothers by their sides, partners left to raise kids on their own and shoulder the burden of providing for a family by themselves. The thing is, we can do something about this. With the Build Back Better Act, we can strengthen our care infrastructure to make sure that every mother and child receives the high quality maternal and postpartum care that they deserve and require. Equally important, today's event will help demonstrate, in terms that are both tragic and infuriating, why our nation desperately needs the Build Back Better Act to pass. Why it is so critical that we grow our parental workforce and hire more diverse providers, including physicians, nurses, and doulas, so that more providers understand the unique care that different patients of all identities require, and why we must encourage state Medicaid programs to implement innovative maternal home health models. It's simple. We're one of the wealthiest nations on the planet. We shouldn't be among the most fatal for new moms in the developed world, too. And we don't have to be. By passing the Build Back Better Act's landmark maternal health provisions, we can become a nation that embodies family values by truly valuing families, ending racial disparities in maternal care, and saving moms' lives across the country. And in doing so, President Biden, congressional Democrats, and the dedicated champions here today will make dramatic progress in supporting families from coast to coast. And with that, I'm going to turn it over to Heather so she can share her story with us today.